All right.
And so I'll put your little extra sticker in here just in case anything happens.
Okay, perfect.
Like if one gets yanked or something.
Okay.
So if one just happens to get yanked off and won't stick back, these just pop on and off like this.
Okay.
So just put that one back where I had it, take this off, throw it away, put that one back where I had it, and just snap that back on.
Okay.
That way you gotta come back up here just to get stickers.
Perfect.
And I have a little, are you feeling a lot of this? That
Yeah.
You're having? Okay. If you would, it's kind of self-explanatory. It's just time, what you were at that time, and what you were feeling. So that way they can see what exactly is going on.
Okay.
You know, when you're feeling it with your heart. Because it's going to be recording like every beat.
Okay, good.
So,
and it's probably better than my Microsoft Band. Because right now it says at 75, but I'm sure it's a little bit higher than that right now.
Okay. So that's all you got to do is just wear it 24 hours and don't take a shower when you have it on so you get it wet, you know.
Okay.
So just do like a little sponge bath until we get it off of you.
Okay.
And you can come back at about this time tomorrow and we'll get it off of you. But
Okay.
if you want to take a shower or anything before you come, just make sure it runs 24 hours and like see how it's blank.
Okay.
I'm going to set it 24 hours so once it's done, it's going to stop recording.
Okay.
And you just take the stickers off and throw them away. And you can actually just
So
wrap
I'm going to
this
sleep
up.
in this too, right?
Right.
Okay.
So you can just wrap this up in a bag, just a monitor with it so they know it's your monitor and give it to the lady at the window, or one of us can take it off of you when you get here.
Okay.
Whatever you prefer.
Okay.
A lot of people just like to take a shower before they leave the house, and I'm like, well, you know, that's fine. Just
So I can take it off myself?
yes, as soon as
After
it's-
24
as soon-
hours,
yes, as soon as
so
it
in about...
stops. About 9:40 probably tomorrow. You
Okay,
can take it
9:40.
off. But
Okay.
it, like I said, it's going to be blank.
Okay.
But either way, whatever you prefer, we can take it off or you can take it off.
Okay.
All right, pull your shirt up for me. Let's see if this
Well, I'll just take it off here.
that you don't have my shade this spot right here.
Okay.
Just so I just want to make sure it's going to stick good. Sorry, well,
It's all right.
it's not summer yet. I'm guessing it'll be summer yet. Just gonna try to get it back off there.
Yeah. And the
Sorry.
shaving cream or something?
Should be good. Just want to make sure you're in contact. That one's right on top of your
So
bar.
the red is the hard one?
Mhm.
Okay.
These are a little higher, so we don't have to worry about shaving that.
Okay.
This one's going to have a little bit on the side. Tattoo friends, a bit of a sticker.
Okay.
You go ahead and start putting your shirt back up. Just let me rub them a little bit to make sure
Okay.
they're. Looks like they're stuck pretty good. You shouldn't have any problem with it coming
24
off.
hours.
Yeah, it should stay on pretty good since it's not summer. You're not going to be sweating or anything.
Okay.
But if you exercise or anything like that,
Uh-huh. Put that on there?
yeah, just so they'll know that because your heart rate may change up on them.
Okay.
Just a little bit. I just like people to know that so they'll know that you were doing something different.
Okay.
See the numbers on there.
Okay.
So once it stops, it's gonna.
It says 10:40 or
Yeah,
10.
it's probably an hour off.
Oh, okay,
It's
that's
really
fine.
like 9, but it's gonna stop itself, so you don't have to worry about
Okay,
that.
perfect. Okay.
Alright, you want me to hook it on your belt, or you gonna put it in your pocket, or? I
Yeah,
just
how do you
kinda-
need...
I can just do this little clip right here.
Okay.
I'm gonna do it like that. And we can just kind of tuck these wires behind
Here, I'll
it.
just put it in my...
Put it in there.
Yeah.
It's kind of a little bit tighter. And we can just kind of lay these. So you won't be pulling on everything.
Oh,
You can
yeah.
tuck that down in your pocket if you want. Those
Okay.
wires. Whatever works for you. Okay. It looks. Okay. Alright, and here's your little extra sticker in your little diary. Just keep up with that for me.
Okay.
And we'll see you about this time tomorrow. But if you
All
bring
right.
it back yourself, just, you know, whenever.
Okay.
Just try to have it back before lunch because we have to have them for other patients.
Of course.
Yeah.
Okay. All right.
rate is bouncing around.
Mm-hmm. Kind of why I'm here.
Yeah. Have you had any more symptoms since you wore the Holter?
Yes.
Just the palpitations?
Yes.
Do you get short of breath with it?
Not so much as before.
Okay. Any lightheaded or dizziness?
Only whenever I have the high heart rate.
Okay. Leave that on your thing for a few more minutes just to see what it does.
Okay, because now it's at 107, 108.
Yeah.
It was at 88. Oh, now it's down to 93.
A little high on the bottom. It's 130 over 90.
Okay. Really?
Yeah, slightly irregular. You feel okay now?
I'm a little nervous now.
Okay. All right, well, we're going to... They looked over the Holter. Dr. Hasty is actually, that's the doctor you were supposed to see.
Mm-hmm.
He had to have emergency surgery, so
Okay.
we're going to let you see Dr. Williams this morning.
Okay.
But they're partners, so.
Okay.
All
As long as I have a doctor in front of me.
Okay, he should be in shortly.
All right, perfect. Thank you very much.
You're welcome.
All right.
Haven't seen you before, right?
No, you have not.
Okay, just have a seat.
Okay. Right here?
Yeah.
Okay.
Sure. Why are you here?
I have been experiencing either called PVCs
Okay.
or high.
You're having palpitations.
Very much so. Yes.
Okay. How long you been having them?
I'd have to say probably on and off, roughly about 6, maybe 7 months.
Okay. They getting worse?
The frequency is not as bad as it used to be.
Okay.
The last time I went into the ER, I
So you've been in the ER for this problem.
I've been in the ER for, yeah.
When did you go?
I'm still living in Illinois, so I forgot all the paperwork.
That's all right. What, so you haven't been in the ER here?
No.
Oh, okay. All right. So Dr. Carpenter sent you here?
Mm-hmm.
Okay. You wore a monitor
Yep.
out of our office that
Right.
showed sinus rhythm, which is normal, and you
Okay.
occasional PVC. And occasional PVC. Really nothing to write home about.
Okay.
Okay? Have you cut out things that cause PVCs?
Smoking,
caffeine?
cut down on that. Caffeine, did all of that, and still was having them.
Okay. You ever been treated for them?
Treated for no.
Okay. Any other medical problems?
No, not that I know of.
Okay. Don't take any regular medicine.
No.
Okay. Got any other risk for heart disease, like family history or?
Yeah, I think my dad has.
LDL's 100, okay. So your father had some heart disease.
Mm-hmm.
Okay. All right. Well, let's see how you sound. Have you had an echocardiogram?
EKG, yes.
No, echo.
The echo?
Sound wave test.
Oh, no. No.
Okay, okay, good. Well, we can certainly do that. Okay, you sound fine. Well, I'm gonna try to get you worked in for an echo real quick, and then after that's done, I'll see you and we'll talk about maybe a treatment plan. Okay.
Sounds awesome. Thank you very much.
Okay.
All right.
All right. It goes normal.
Okay.
Completely normal.
Good.
All right. So I'm going to put you on a little beta blocker.
Okay.
It's a little drug. It's a class of drugs. Slow the heart rate, lower the blood pressure just a tad, take irritability out of the heart, and we'll see if you tolerate it.
Won't take irritability out of me, though, too.
You're going to have to be the judge of that.
All right.
I'm going to give you a very low dose.
Okay.
I don't think it'll be enough to hurt you.
Okay.
But you probably could stand it because your diastolic's 90,
Okay.
and you do have symptomatic ventricular ectopy, as it's called. The ventricle, PVCs.
Okay.
Premature ventricular contractions,
Okay.
ventricular ectopy. Ectopy means extra beats.
Okay.
Okay, so you are symptomatic, and you can take it when you want to. You can take it if you're having a bad month and you're having more of a flare. You can take them, and if you're not having a bad month, you can stop them.
Okay.
I'm going to give you a 25 milligram tablet, and you can start with a half a tablet at night.
Okay.
And if that doesn't do it or does the trick, you can stay with a half. If you want to try the whole, see if it affects you.
Okay.
Take the whole tablet.
All right. Now, how should I start exercising again?
You have no restrictions.
No restrictions?
You have a normal heart.
Okay. All right.
Completely normal.
All right.
Okay?
Perfect.
Be right back.
All right. Thanks a lot.
All right.